So here is my lymphatic flow poster trifold presentation for our lymphatic project. Over here I have the different types of cancers we were to research for the lymph node spread. I will briefly go over each, and for each type of cancer that we were to research, I included diagrams of both the area and the lymph nodes as well. So first for the lung, I have the lymph nodes outlined here along with a diagram of the lungs. Underneath, I typed my information just because my handwriting stinks, and also it gives me more room to include everything. So for the lung cancer, depending on the location of the tumor depends upon the lymph nodes impacted. Lung cancer that spreads to the lymph nodes can be divided into 3 regions. Intrapulmonary lymph nodes, which are, they refer to lymph nodes that lie within the lungs. They can either be peripheral lymph nodes. These lymph nodes are lymph nodes that are found in the outer regions of the lungs. Also, hilarious lymph nodes are lymph nodes that are present in the region of the chest where the bronchi and other major arteries and veins enter into the lungs. I might slaughter a couple of these words, so I'm sorry. Medial lymph nodes. These lymph nodes are lymph nodes that are present in the area of the chest between the lungs called the mediastinum. Then you have your extrathoracic lymph nodes. These lymph nodes refer to the lymph nodes found outside of the thorax. These are supraclavicular lymph nodes that are located in the area just above the collarbone, and scalene lymph nodes. These lymph nodes are in the neck near the uppermost rib. You can also classify lymph nodes based on the side of the body where they are located. Okay. Epilateral lymph nodes. These lymph nodes are lymph nodes on the same side of the body as the tumor. Contralateral lymph nodes are lymph nodes on the other side of the chest from the tumor. The drainage, I did mine a little differently. I included where they mainly drain and the main lymph nodes involved with the drainage. So the lymphatic drainage of the lungs starts with the lymphatic vessels that first drain into the intraperitoneal lymphatics and lymph nodes, then move to hilarious lymph nodes and subsequently move to subcardial, tracheobronchial, and paratracheal lymph nodes. The lymphatics then communicate with the venous system via the bronchial metastatic lymphatic trunk in the thoracic duct or via the inferior deep scalene lymph nodes. However, some variants of the lymphatic drainage can vary depending on location of the tumor. And also, guys, please excuse my diagram of my person. I tried to make it as even as possible, but art is definitely not one of my strengths. So moving over here to the breast, I was sure to include a picture of the breast showing the lymph nodes that can be impacted from the spread of breast cancer. Here is just a diagram labeling the lymph nodes in the breast that can be impacted as well. So for the spread to the lymph nodes for the breast, again, it depends on the location of the tumor, which lymph nodes are impacted. And the lymph nodes that can be impacted in breast cancer are the following: supraclavicular lymph nodes, subclavicular lymph nodes, distal axillary lymph nodes, central axillary lymph nodes, proximal axillary lymph nodes, mediastinal lymph nodes, internal mammillary lymph nodes, interpectoral or Rotter's lymph nodes. Drainage, ultimately lymph nodes on the right side of the breast drain into the right hepatic duct. Lymph nodes on the left side of the breast drain into the thoracic duct. Okay, moving on to head and neck. I made sure to include a diagram of the lymph nodes in the head and the neck. And down here is a picture of the lymph nodes labeled that can be impacted by the spread of cancer. So for head and neck, again, depending on the location of the tumor, it depends on the lymph nodes involved in the spread. But possible lymph nodes that could, the cancer could spread to is occipital lymph nodes, retro and articular lymph nodes, partenoid lymph nodes, superficial lymph nodes, buccal lymph nodes, submandibular lymph nodes, deep cervical lymph nodes. Drainage, here I have the superficial vessels drain lymph from the scalp, face, and neck into the superficial ring of lymph nodes at the junction of the neck and head. The left jugular lymphatic trunk combines with the thoracic duct at the root of the neck. This empties into the venous system via the left subclavian vein. The right jugular lymphatic trunk forms the right lymphatic duct at the root of the neck. This empties into the venous system via the right subclavian vein. All right. Moving on to the female pelvis. Here I have a diagram of all the organs in the female pelvis labeled, and also a picture of the lymph nodes that can be impacted from the spread of cancer. Here, let me move on this side. Sorry guys, I have my daughter videotaping me. So, depending on the location of the tumor, depends upon the lymph nodes impacted. There are 5 types of female pelvic cancer. They are cervical cancer, ovarian, endometrial or uterine cancer, vaginal, and vulvar cancer. Lymph nodes that can be impacted by female pelvic cancer are the following: lumbar lymph nodes, inferior mesenteric lymph nodes, common iliac lymph nodes, internal iliac lymph nodes, external iliac lymph nodes, superficial inguinal lymph nodes, deep inguinal lymph nodes, and sacral lymph nodes. Drainage: the female pelvis lymph nodes drain into the common iliac lymph nodes. The male pelvis, here I have diagrams of the male pelvis and the different organs in the male pelvis, along with the lymph nodes that appear in the male pelvis. This is a good visual. Depending on the location of the tumor, depends upon the lymph nodes impacted. There are 4 types of male pelvic cancers. They are prostate, testicular, penile, and bladder. That could be for female as well. So I could have added that. So lymph nodes that can be impacted by male pelvic cancer are the following: lumbar lymph nodes, inferior mesenteric lymph nodes, common iliac lymph nodes, internal iliac lymph nodes, external iliac lymph nodes, superficial inguinal lymph nodes, deep inguinal lymph nodes, sacral lymph nodes. Drainage: it's the same as the female. Male pelvis lymph nodes drain into the common iliac lymph nodes. Moving on, I kind of combined all the large bowel opponents. I was sure to also do pictures of diagrams showing the rectal area that can be impacted, along with the colon and anal as well. So here is the different lymph nodes that can be impacted by these types of cancers. Underneath here, I have, again, depending on the location of the tumor, depends upon the lymph nodes impacted. There are 3 types of cancer that can occur in the large bowel: colon, rectum, and anal cancer. Lymph nodes that can be impacted in large bowel cancer are the following: right colic lymph nodes, middle colic lymph nodes, superior mesenteric lymph nodes, periocolic lymph nodes, left colic lymph nodes, inferior mesenteric lymph nodes, ileocolic lymph nodes, internal iliac lymph nodes, pelvic lymph nodes, inguinal lymph nodes, periorectal lymph nodes, perioaortic lymph nodes. Drainage is a little different. The inferior mesenteric lymph nodes drain into structures in the epigastric portion of the intestine where the colon develops. The lymph nodes remaining in the large bowel drain into the superior mesenteric lymph nodes and finishing to the preaortic lymph nodes that are surrounding the inferior mesenteric artery drain directly into the preaortic lymph nodes. They then drain the descending colon and sigmoid parts of the colon, as well as the upper part of the rectum. Over here, I have a list of the references that I use to make my lymphatic flow project. I hope you all are staying safe during this coronavirus outbreak. See you soon.